here, we've got an exciting agenda for everyone today. I'm going to just jump right into it because we've got a lot of content to cover. So today we're going to be meeting with Michael Doctor. He is co-founder and CEO of Doc Health, a HIPAA-compliant workflow management and collaboration platform built specifically for healthcare. Doc was spun out of Boston Children's Hospital and seed funded by August Capital in 2020. And Michael does remain a practicing gastroenterologist at Boston Children's Hospital, where he was also the former clinical director of innovation and director of clinical mobile solutions. With more than a decade of clinical practice, he's truly been at the forefront of design and implementation of health technology, and he's been part or led many cutting-edge initiatives from implementing secure messaging, mobile EHR, and voice-enabling mobile technologies to developing a virtual reality platform for customizable patient education. So very excited to have him join us today. We also have Jessica Gulish, our sales leader and Spruce expert, joining us today to share some insights into Spruce and answer any questions that the audience may have about Spruce. But before we get there, let's go over some light housekeeping. There's a Q&A function at the bottom of your screen, and that's what you'll want to use to ask questions of any of the panelists. We will address them as we go if they're relevant to the content that we're covering, but we'll also save time at the end for more of those questions. And as a reminder, this will be recorded, so don't worry if you've got to jump off early or if you feel like you missed something. We will share the recorded link right after we wrap, so keep your eyes peeled for that. We can also share slideware if folks are interested, and the other resources that will be mentioned at the end of the presentation. So that was a fairly comprehensive introduction for Mike, but I'm going to let him add anything that I may have missed, and I'll also let Jessica tell you about herself. I'll let them also get into the heart of today's conversation, and with that, I'm going to let them take it away.
Thank you, Carrie and Jess, and thank you to the Spruce group for organizing this and inviting us. I don't have much to add beyond that very comprehensive intro for me. So thank you, and looking forward to talking more about what we're doing at Doc Health and how we can create more efficient patient care.
Hi, everyone. Excited to talk to everyone today and answer questions and share information about Spruce and Doc. I'm particularly interested in this conversation because I've been at Spruce a little over 6 years now. And prior to that, I worked in medical offices in sales and management. And I saw a lot of disorganization and inefficiencies. And for me, that's one reason I joined Spruce, was because I wanted to help with communication and patient communications. So, but there was a gazillion other things that I saw that were inefficient that I just wanted to get my hands on and fix. And so I'm so excited Mike has taken one of those other things, which is task management, and is trying to chip away at another healthcare, challenge that we see. So I particularly just wanted to say that. And again, if you have any questions, our contact information is going to be at the end of this webinar. Oh, okay. And more about Spruce. So most people on this, there may be some customers and maybe some people that have heard of Spruce or don't know what Spruce is at all. So just wanted to give a little commercial for Spruce, that we are a patient engagement app. We do everything that could entail with communication. So everything from your business and office phone system to a virtual phone system, so you can use your mobile phone, answering service, after hours kind of like access, as well as comprehensive two-way SMS texting, including MMS. We also do fax, secure messaging, telemedicine, notes, and team collaboration. So it's just about everything going into one unified platform so you can all collaborate, like I said before, efficiently, and patients and providers and teammates and staff can all communicate easily. And that's what we do every day. I've been living this world for almost 7 years. So any questions about that too, feel free to ask those in the Q&A below.
And so Doc is a HIPAA-compliant task management platform. So think of us as a to-do list for healthcare, specifically built for healthcare. Fundamentally, was built to solve my own pain point as a clinician, practicing pediatric gastroenterologist, and managing all the to-dos that are there to help take good care of our patients. And I think the real gap that we appreciated, as the inception of Doc is really just having a real need to manage all the administrative to-dos for our patients, and ultimately not having a good tool to do it, and being inspired by the tools that are out there for the rest of the world to use. So tools like Asana and Jira and Trello and Wunderlist, if anyone remembers that tool that was bought by Microsoft a couple of years ago. We all have our little paper checklist. Ultimately, we need a better way to manage all the to-dos for our patients, to collaborate as a team, and ideally to make that as integrated into our workflows and our processes as possible. So looking forward to sharing more about what that's all about.
Awesome. Thanks so much, you guys. I think that's really helpful to just give us that high level out of the gate so we know what we're going to be covering. So getting into the meat of this, I'm just going to ask you both and let you run with it. But what would you say are some of the biggest sources of fatigue or frustration at work today, specifically in healthcare?
Yeah, I'm happy to take the first one if you don't mind. Certainly this is really the inception of Doc, was really my own personal burnout, which was fundamentally working at arguably one of the best children's hospitals in the country, but really struggling with this pile right here. Unfortunately, this isn't my desk. This is actually my colleague's desk at Boston Children's. But nevertheless, this is the administrative burden that folks face. And frankly, there are not good tools, irrespective of an electronic health record or other solutions that we use, which generally, again, are very antiquated, which Spruce, I know, is trying to replace a lot of those antiquated tools. But this is the straw that broke my back. And frankly, I think we hear so much about the epidemic of physician and clinician and frankly, administrative burnout. It is all that administrative tasking that we have to do. And we don't have great systems in order to manage that. So, really looking forward to talking more today about how we attempt to tackle this problem. And I think, this image is representative of everyone being overwhelmed, care teams not collaborating well, and the EHRs, irrespective of whether it's a homegrown EHR or it's a big epic implementation that costs $1 billion, they have not solved for this administrative problem. I know Spruce is working hard to tackle some of the same problems we are.
Yeah. And Mike, I talked about it earlier, like this is exactly what I would walk into in every doctor's office. And I would always make jokes and say, I have a feeling this is a system. And usually this was some sort of system. And we'll get to that everyone does actually have a system. It's just how well is it working? And, I'm sure I see some at different directions. I'm sure they're all in different priority in that list right there. So love this example.
Everyone knows where that one sheet of paper is in the pile there, but there are better ways to do it. And there are better ways to collaborate, and there are better ways to create those processes. So yes, we'll be talking a lot more about that.
Awesome.
And from my perspective, they're really the crux of the issue is that there are in fact two halves of healthcare. And I think to date, no one has really acknowledged this, but this has been our observation, which is that the clinical system has their half, and that's where we document and bill and prescribe and do all of our I spend all of our time as clinicians, managing the patient care and documenting it and scheduling and doing the rest of it. But the reality is that all that intent needs to move over into the administrative team to make sure that those tasks get carried out, to bring a patient to the starting line of a clinical process or even the finish line of a patient's journey. And unfortunately, all of that work is being done in really antiquated, crappy tools for the most part. And so that's things like Excel files and Post-it notes and, obviously email and fax. And those are the de facto tools of most of healthcare. And this may be an informed audience that is using tools like Spruce, but the reality is that those are two very separate spheres. They don't really talk to each other. There's very little opportunity on the administrative side to create process automation, to create process improvement, to capture data, to understand and learn from those insights. So that is certainly our area of focus. And I would put some words in Spruce's mouth there that you guys are also focused on the same problem.
Yeah, definitely. Also, I wanted to call out, Mike, because, we talked before, you came from a large, hospital-based system. And I think a lot of people on a call, a lot of our customers, a lot of your customers as well, are also small practices. And so even though we're talking this clinical half and other half, this can still be relevant, right, in a 4-person practice.
Yeah, super relevant. And, again, I came from an academic institution, but the pain is felt everywhere. And we help, practices, particularly mental health practices, but really practices from all shapes and sizes, from the single practitioner to to a larger health system or a health technology company. But this pain is ubiquitous across healthcare, and the systems and the tools that folks use really, need a refresh, particularly on the administrative side. And unfortunately, they're not anchored into the clinical system. So we'll get into that more. But how do we bring that insight from the clinical world into the administrative tasks and the administrative tools that we're using?
Yeah. Yeah, I think that's important. And Jess, I know you touched on that as well. And we've seen the same thing on our side of the house, irrespective of group size. It's really about the collaboration and the communication and the management of those things. So thank you for that, you guys. Moving on, I'd really be interested in knowing why you both think balls get dropped in healthcare. Why does that happen?
Yeah, maybe. Jess, maybe you go first on this one.
Well, no, this slide I think is a slide that you demonstrate exactly what's happening today. And I always talk about this as well as Spruce, and voicemail comes in and it may be on like a regular phone, and you don't know if someone's called them back or not. There's no documentation or audit trail of telephony or phone, or when did they call them back? How long did they call them back? It's a different system, or maybe they emailed them back or text them back, but it's different systems. So I sell that about Spruce, like, make your life easier. Don't guess. Don't have two people do the same job. Ping the doctor right below that voicemail. So this is something I see and it's just a new concept almost, because we're so used to doing these like step-by-steps where things get lost. But I love this example. So you explain this a little bit.
Yeah, I'm sorry to everyone that has look at this. This slide was meant to be horrific to look at. It was meant to represent my life as a GI doctor, trying to get a patient from clinic on the left-hand side to the infusion center on the right-hand side. And really just showing when we were working on doc and had the chance to pull back the curtain and see, like, what does this actually look like? It's a hot mess. And it's frankly just humans moving data around with really antiquated tools and lots of, off ramps and opportunities for friction, or what we call drop balls. So that those, the game of telephone is alive and well in this image. And this could easily represent really any clinical journey in any type of practice or organization. It's just getting patients to where they need to go. And I think just to sort of state the obvious, part of my frustration with how healthcare works now, and frankly, why I left the bulk of my clinical practice to, try and solve this problem, is that, we place so much impetus on the patient to manage their own care because we're so crappy at doing it ourselves. And I think if you look at any other well-run organization outside of healthcare, they pride themselves on the ability to manage a process, to have visibility into a process, to have accountability. We use tools like CRMs, and we use tools like, telephony solutions that, have audit trails. And that stuff doesn't really exist in healthcare. And so we just tell a patient, call my office next week and make sure that we did that thing for you that we told you we'd do. Or, call the provider that we referred you to make sure that they got the documentation that we promised we'd do. And there's so much of this stuff that is frankly stuff that we should be better at as clinicians, as providers of care. And primarily the main difference between concierge and really expensive care is that someone is tracking that stuff for you, as opposed to most of the people in the world that get non-concierge care. And it's, still, patients are responsible for all this stuff.
Yeah.
Okay, good. So when the balls are dropping, tell us what's going on here. We've got some stats.
Yeah, well, there's just an incredible amount of downstream impact from those drop balls, right? And we've calculated there are over 100 billion opportunities for drop balls in the U.S. every year. So, that adds up. And I think there's certainly the obvious financial implications of that to an organization, lost revenue, certainly at a macro level, it's incredibly wasteful to the U.S. health system, and lots of, dollars wasted on hiring more administrative staff to address a problem as opposed to applying technology and automation to solve a problem. Certainly the physician and nursing, and I would add into that administrative burnout is, it's incredibly expensive to replace staff. I probably don't have to tell anyone on this call that, keeping your staff happy and simply keeping your staff period is an incredibly difficult challenge. We hear from so many of our customers right now that people are just losing staff left and right because, of the availability of other jobs that maybe are a little bit easier or pay better or whatever the case may be. And then I think most importantly for me, and part of it fundamentally why I went on this mission to help solve this problem, is that so many of my patients would end up in the emergency room, missing their infusion, or being the sort of the end result of an administrative misstep that was entirely preventable if we had better visibility and accountability around these processes. So, back to that sort of last image, the hot mess express of healthcare. The intent is to better manage these processes to prevent these generally very preventable administrative missteps. And it's all about creating a process. It's being accountable to those tasks and making sure that we do them for the patient to ensure that their care is highly reliable.
Definitely. I think that these stats are crazy, but they also make sense because I think we've all felt this as patients before. And from the Spruce perspective, I can't tell you how many people come to us, needing solutions for, doing phone calls better, or, patients are coming in saying they left a message, but they have no idea that the message came in. Or so the patient satisfaction, I think, is a harder one to measure. But when you're doing these things more efficiently, less calls, because less follow-up, because things worked more smoothly, or you've already followed up with them. There's there's a lot of different ways that you can do that. So you can, patient satisfaction, reviews for your website or for your office on Yelp could be improved. Like there's just so many also ancillary things that can happen when you fix this administrative burden.
Yeah, I would just want to point out, like, this isn't like someone messing up, right? And, like I'd like to think I was a really good doctor, and I had the best intent, but the tools and the systems I was using didn't allow me to provide the best care. And, I think that sort of accountability and visibility is really, people need the right tools, and we think that we can give them superpowers instead of just feeling like they're operating in this, like blender that's just so, things are just happening all around them and they can't control the chaos.
Yeah. Definitely. When I moved from healthcare to tech, it was unbelievable how many tools we used to help manage our customer journey, and not forget anything. And I was like, why wasn't I doing this in my old job? Like, why weren't we doing this in healthcare? Like, and I understand now, obviously it's a hard issue, but it's definitely, I think we're slowly but surely fixing it. So I'm optimistic. So, well, let's get to the solution.
Yeah, I was going to say that segues nicely into the kinds of tools that folks are using to collaborate better with colleagues.
Yeah, I'd be curious, if folks are going to, throw some comments in there, but for sure the de facto tools are, Post-it notes, email, faxes, and hopefully we're collectively, both Spruce and Doc, moving folks to, more accountable, more tech-enabled systems. But, this is really our vision, just to speak to this for a moment, is that, there is no administrative home for, the administrative team to help the clinical team manage tasks and manage processes for patients. And so our vision is to really, in many ways, replace those antiquated administrative tools, working with wonderful solutions like Spruce and Google Workspaces and other productivity tools, but importantly being anchored into the clinical system. And at the end of the day, our belief is that a task with patient context is the lightest weight essence of care that allows you to convey what needs to be done for this patient, who's responsible for that. And that can happen certainly within an organization, but beyond as well. So how do we help integrate care across the healthcare ecosystem and collaborate between a primary care doc and a mental health provider, a primary care doc and a specialist, or even at some point in the future connecting directly to payers, and how do we facilitate all that collaboration that needs to happen? And of course, we're a tech-enabled company, so we can do a lot of these connections to other technologies through APIs and fancy stuff like that. But at the end of the day, we want to be that administrative hub, connected to the clinical hub and working. You'll see that this is now one holistic view instead of those two halves, as we've shown earlier.
And Mike, you mentioned the EHR. So beginning the hub, you guys have directly integrated with a bunch of the major EHRs, right?
Yeah. So I mean, the big guys like Cerner and Epic, we integrate with. Those are for like the big hospitals and health systems. But I think more importantly, particularly for this group, is the Elations of the world, and Athena and Dr. Chrono and Advanced NV. And we have a long list that I'm happy to share on our website. But at the end of the day, what we want to do is trigger the administrative tasks that are implied within an order or an event that's occurring. So a patient books a visit, that kicks off the administrative tasks that are associated with that process and make sure that the clinical and the administrative team are working seamlessly together. And so, that's just one example, and I'm sure we'll get into others, but how do we make that a seamless process? So it's not just, that clunky sort of hoping, crossing our fingers and closing our eyes and hoping for the best, which is typically how we do healthcare right now.
Yeah. Well, and then of course, everyone needing the same tools. I think that's a nice dovetail into this one.
Yeah, I think, our observation and certainly my personal experience is that, clinicians are in the EHR, whether they like it or not. That's where they need to be. They need to do the documenting and the billing and the prescribing and the ordering, et cetera. And the administrative and operational people are forced into the EHR because that's where they have to go dig stuff up. And I think there's plenty of, these ancillary tools, email, faxing, et cetera, that become these sort of paths of least resistance where people are just trying to collaborate with really antiquated tools. And again, the rest of the world has moved on to project management, task management, things like Slack and ways that we can more easily communicate and collaborate as a team. And so our belief is that the care team, broadly speaking, so we think of, clinicians and administrators are all part of the care team. And of course, the patient as well, which we'll get into. And they all need to be on the same page. They need to understand where a process is in flight. They need to collaborate on these tasks. Some are clinical, some are administrative, some are operational. So everyone needs to be on the same team and with the same tools. And so that's, again, the vision for Doc is understanding the clinical need and the intents and events and providing the administrative sort of dashboard so that people can manage processes together.
Yeah, definitely. And, Spruce, we work with this a lot. When we first started, we actually started as a teledermatology company. And why we pivoted to the Spruce you see today was because people love this virtual ability to speak with the medical assistant and the doctor. And the doctor loved that the medical assistant was the first point of triage but they could easily just escalate it up to the doctor so quickly, or the doctor could go directly to the patient. So this little trifecta of communication was so helpful. And we're like, there's not as many people doing this. Like EHRs were just going directly to the doctor only. And then the doctor would have a bunch of, messages to check each day. So that's one reason we created Spruce. But when we then started, we only had it was a single line for the doctor to use on their cell phone. So then we started with just the doctor using it. Then instantly they would add their staff to help. And then we found that actually over time, the staff were some of the super users of Spruce because they're the one answering a lot of calls, being the first line of defense. But if you don't have everybody on the team, whether it's a practice manager helping with billing issues or selling, the practice, or the doctor, or the clinical team, then it just slowed everything down. And so the unification, I think, of communication and just tasks and everything has been a game changer in healthcare because everything was so siloed before, and especially with HIPAA compliance, I think we kept it siloed for lack of knowing a better way to share data securely. So I think we're gonna see even more evolution of this, especially between multiple software companies, more connectivity, as well as different practices connecting more securely. So I'm really excited about this and definitely agree wholeheartedly that you have to have a team approach or else you're just going to be inefficient from the start.
Yeah, maybe, sorry, just to rewind for a minute and mention one sort of amazingly sad, example of this. So there was a great study out of Kaiser Permanente, which is arguably one of the best, integrated health systems in the country. And, they use Epic, which is arguably one of the best EHRs out there. And 58% of patients that had abnormal kidney function tests during a routine screening lacked timely follow-up because it got lost in their in-basket. So their in-basket is the EHR's version of an email inbox. And that is, as you mentioned, messages all get sent to the doctors and they get sort of buried there. And so that was my own experience. And I think, I can imagine the folks on the call here have their own systems and tools, arguably things like the EHR in basket and email and, things just get buried there. And so we believe that, that's like inbox medicine and how things used to be and how they often are for many. But there is a better way to do things with more accountability and more context and more visibility, and directing tasks to the right people to delegate more easily.
Nice. That makes a lot of sense. With respect to that, what all can be done with that reclaimed time from the inefficient care delivery?
Yeah, so again, for me personally, I've got 3 young kids. Part of what I was excited about, leaving my full-time clinical role and focusing on this was to spend more time with them and watch them grow up, which I was struggling to do as a busy clinician. So for me, giving clinicians and folks in healthcare more time back has been a mission. And my hope is that folks, can find more joy in their work, and provide better care for patients along the way.
Mm-hmm. Well, and Jess, you've seen firsthand what an incredible time saver I know Spruce has been for folks. We've done a number of case studies on the efficiencies there. Do you want to share any of that?
I mean, and coming from like a sales revenue point of view, I always say, well, you could make more money as a business if you're more efficient with who's at your practice. And it isn't necessarily like eliminating employees and saving on that cost. It could actually just be having new patients come in fast, more easily. And then you're having more patients and you can see more patients per hour. And those type of things I think are really valuable. But I mean, what Mike's saying, I've always loved healthcare. I've been in it since I graduated college, and it killed me to watch doctors doing more administrative tasks and not doing what they got into health medicine for. So I think for me, I also just love to see people doing what they want to be doing, which is caring for their patients, and they're able to spend 10, 20 more minutes with their patients because everything is just more efficient in their entire practice. So that's my passion on why I try and work at Spruce to get that accomplished. So patients can communicate, doctors can communicate, and the people that are in charge of doing all the other tasks can do them efficiently so that the doctor doesn't have to worry about it and they can just care for the patient. So I feel very passionate about that. But yeah,
Maybe
this
just,
slide, yeah, go ahead.
Sorry, I will just say that. So what we're looking at here is this is what we would call a smart flow, and really, it's just allowing folks to build out their processes. And so what is important, to doc, and I think any good task management platform is, how can you allow processes that are routine and mundane to be templatized, and take out that sort of variability that is just rife in healthcare right now, and create processes that live in a system that is accessible to everyone, that folks can remain accountable to. And that way, you build organizational resilience. You take your best practices, you put it into a system that everyone can see, and you can operationalize it and ideally automate as much of that as possible. So part of this, and this is just an example of new patient onboarding. So the number one sort of use case that we help every practice from all shapes and sizes with is just how do we facilitate that, that new patient coming in to make sure all the boxes are checked. And so, most healthcare organizations, they have a paper checklist on, one administrator's desk, and that's how they make sure that those things are done, or they're running it in an Excel file. And what we can do here is capture the tasks that are routine, that can be, automated, connecting these various systems to each other in a way that typically isn't done in healthcare. And providing that accountability so that we can make that process easier for the patient, make it more reliable, ultimately for the practice, make it more efficient. So we've, saved some organizations, 90% of the time spent on this process, and made it a more reliable and automated process along the way.
Yeah, and Mike's talking about how, Doc has helped, customers as well. And I think also it's just so important that everybody on the call looks at their current process and evaluates, like, how am I doing this? How can I make it more efficient? Can I implement different systems such as Doc, or even just, moving that paper checklist to Excel? And then when you, move to something like Doc, once you're getting even more upgraded in your administrative, organization, then you're all set and you already know where your holes are. So, and we're going to go into that a little bit more later, but I think it's so important. And over this, looking at this webinar, I'm now evaluating how I do things, even just in sales and in business. And am I as efficient as I possibly could? And no.
I think just double click on that for a minute. I
Yeah.
think a lot of the time that we spend with customers is just defining their processes. And these are things that I think, as you said, irrespective of doc, like these are things that need to happen for organizations. And I will tell you, I'll be the first to tell you that, you don't learn anything about running a business in medical school. That is not, at least when I was there, this is going back, 20 years now, but you don't learn about project management. You don't learn about, the business and operations of that. And I think what's important and what every other industry has appreciated is that, like, you have to understand what your processes are. And so, we provide a great platform that allows people to capture their processes and put them in a place where it's actionable for folks. But, we spend a lot of the initial time just saying, okay, what does ideal look like for you? What is your onboarding process, and how would you like, if you could design it from scratch, what would it look like for you and your people in your organization? What would it look like for your patient? How would you provide the best experience for them? And that's part of the sort of hospitality that is often missing in healthcare.
Yeah. And I was just thinking that for new practices who are currently evaluating a tech stack and, what do I need to be effective? This is probably both eye-opening and makes a whole lot of sense. But back to your point with that first slide, with the messy desk, for practices that have been, handling it in their antiquated methods, but it's been working for them. Is there any amount of overwhelm with respect to the kind of okay, I've got to put something brand new in place. What is that going to look like? How am I going to get folks on board with this? How have you guys, I guess, sort of managed that fear, if you will?
It's tough, Carrie. Like, there's so much resistance to change in life in general, right? But in healthcare in particular, because this is how we've always done it, and even if it's inefficient, even if it's not even ideal for us or our patients, like, it's too scary to do something new. And so I think it certainly takes some change management, and I think more than anything, it takes leadership at the organization to say, listen, we can do this better, and this is how we're going to do it. And it's going to hurt a little bit. And it's going to take a little bit of time to overcome the inertia of just trying something new. But we're all going to be better for it in the end. And so that, I think, it takes leadership. And I think sometimes that leadership doesn't necessarily come from the practice owner. It comes from the practice manager or one brave administrative person to say, doc, this sucks. We got to do this better. And so we get, the leaders come from everywhere, but ultimately it needs a champion to say, we can do this better. And it feels good to help build better processes for the clinicians, the providers, broadly speaking, the administrators and the patients.
Yeah, that makes a lot of sense. I know Jess encounters that every day. You're on the front lines, Jess, answering those very questions and kind of navigating that slippery slope of, look, it may feel like a little bit painful at first, but it's so worth it in the end.
I'm a therapist, I say.
That's right.
A therapist for new businesses starting or businesses making changes. I'm there for them to support them. Also, speaking of them, I want to remind everybody, I saw someone raise their hand, which I don't know what to do with that on Zoom, but hi, I can wave at you. But I think if you have a question, hover over the presentation and go into the Q&A and ask those questions. And we get to them as they come in as well. We're going to have a section where you can just ask questions as well, but put them in now so that you have them ready for that area. So, but continue on. There's some good stuff coming.
No, that was a good reminder. Thank you for that, Jess. So moving on into what drives greater accountability.
Yeah, I think, I mentioned it earlier, but I think it's structure, it's process, it's having, what are our best practices, our standard operating procedures, our SLAs, whatever your organization calls them. But how do we create the tasks that are assigned to the right people on the team or teams of people? How do we make that actionable? So again, task management, project management has transformed other industries. We're simply bringing it into healthcare. But how do we make those processes more highly reliable for the patients and the care team by putting structure and accountability around it, having an audit trail so everything's visible, understanding, when you have a template and you do the same thing over and over again, you begin to see where are the bottlenecks, where are the inefficiencies in this practice? Why do we, why is this one step taking longer than it should? And so, having that, again, structure, accountability, visibility into processes really makes obviously things more efficient. They can be automated, and then of course, the care ultimately is better.
Yeah. And I think that audit trail is really key. And that's a huge one on the Spruce side. Jess, talk about how that's been so instrumental with so many of the folks you've spoken with.
Yeah, I think, just like Mike, they're trying to tackle kind of old processes into modern ones that include technology. With Spruce, a lot of the inefficiencies we see are in the phone system. I mean, it's just the voicemails, phone call, missed calls, all of that just kind of gets lost in an abyss in most practices, or handled at the end of the day where you're listening and trying to get the message. With Spruce, we can create automation. So in a phone tree, press 1 for new appointment, press 2 for billing. If someone presses 2 for billing, you can have it go straight to voicemail and have it assigned to the billing person. So that way, it's not all going to one cluttered inbox. It's now automatically assigned, so things can be prioritized and handled in the right order that is right for your practice. And I think that's another thing, is like, every practice operates so differently and wants different things, but you just have to know what you want and then just implement it. And both Spruce and Doc can do that. And we not only have assignment of voicemails and texts, you can also, have tags to have labels for patients to know who needs to be helped at a priority, or needs to go in a folder so that the doctor can see every single patient labeled or tagged with their tag. So there's just a ton of different ways that if you see an inefficiency in your practice, see if your technology partner can fix it. Like, is there something that they can do? And actually someone mentioned, how, when to use Spruce, when to use Doc, and it can vary. So with Spruce, you have your phones and assignment and all of that with your texting and communication. And then Doc is where you're going to go next level in tasks per patient. So it's almost like the marriage between the EHR and Spruce in a sense. Doc's going to have the tasks for that patient specifically, all listed there and connected to the EHR, connected to Spruce, which we'll show the integration in a minute of how we connect. But just wanted to call that out for those people asking about that. But keep the questions coming. I love them.
Yeah.
Yeah, maybe just to clarify that.
Yeah.
Sorry.
Yeah, please.
So I mean, Doc really just, again, can create templated sets of tasks, or what we call smart flows, for an administrative process, whether it's a referral or it's a refill request, or it's a new patient who's being onboarded, or it's simply driving. Eventually, when we more deeply integrate Doc and Spruce over time, we'll be able to drive voicemails into Doc, and that might kick off a whole set of processes. So it's really managing all the tasks for patients, some of which are phone calls and messages, which we would ideally trigger that to happen in Spruce. But it's really codifying those things that are otherwise just in our heads, or in an email that otherwise would get lost and buried.
Yep, that makes a ton of sense. Okay, so let's keep going on this. I like this whole topic of creating efficiencies and access. So I'll let Shell wax on that.
Yeah, I mean, I think at the end of the day, it's all about communication, and it's about care integration. And I think the challenge with care, whether it's integrating care within an organization, or it's facilitating collaboration outside of an organization, we need a singular place to go. We need to, again, have our best practices and our processes in place. We need to have that organizational resilience, so that if, God forbid, someone has COVID and they're out for the day, everything that doesn't come to a grinding halt. And we see that so often, particularly in smaller practices, but frankly, all the time at large institutions, is, someone's out at the front desk and that was the only person that knew how to do that thing, and everything comes to a grinding halt. And that's, it's not acceptable. It's not, it's not good patient care. It's not how businesses certainly would run, and ultimately, patient care suffers. So how do you create that organizational resilience? Through capturing your processes. And then again, how do we automate as much of that as possible? And for us, we focus a lot on capturing the process, which is a very bespoke, customized experience, right? Every practice is different, as Jess said. But then what is part of your tech stack, and how do we automate as much of that process as possible?
And I know for Jess, automation is huge.
Oh yeah, I mean, that's how I survive as well for, Spruce customers and leads. But yeah, I thought this, Mike and I talked about this. I think this is super interesting because I think half the battle sometimes is sitting down and figuring out what your processes are today and where the holes are. So Mike had some cool things to say that, with Doc, they'll help assist you. And they have a couple different ways to do that, which I thought was really helpful because sometimes when you've been doing the processes so long, you don't even see the holes. And so he said he has some online tools, plus you can kind of upgrade to some additional services, right? Am I getting that right, Mike?
Yeah, happy to get into that. I mean,
Yeah.
we offer, again, it is just about creating your processes, and we give people a running start. So we have a library of templated tasks. So, what does a standard new patient onboarding workflow look like? What does a standard outbound referral look like, or an inbound referral or refill request process? And so it's just codifying what are the tasks that are part of this process. And then again, how does one customize it for your organization? So how do you take that and run with it with, these tasks are typically assigned to this person, and this task typically needs this form that I need to fill out. So it's a lot of that, again, just giving people templates out of the box, but we do offer our consultative services to really help organizations define their processes, to use our, we've now implemented in hundreds of practices. So how do we take those learnings and help others benefit from that? How do we wire those processes up to your system? So whether it's your Elation EHR or your type form on your website or your intake queue or your Google workspaces and Google Forms, like how do we then take your processes and connect it to your systems? And again, automate as much of the mundane as possible to make it more efficient, more reliable, and make everyone happier in the end.
Yeah, no, that makes a lot of sense, because I imagine without those baselines, a lot of practices probably have no idea where to begin to evaluate their own processes. What are we doing right? What are we doing wrong? And what does the ideal look like? So that sounds like a great way to get folks on track.
I actually see a question about this specifically, so I thought we could just attack this right now. So it says, what automations can be created between Spruce and Doc Health? When a message comes in, can it be assigned based on the words they use? Can it create a task for appropriate person? Is there a phone tree for SMS and secure message? So I'll take most of this, since this is more communication. And then when we address the integration, if you have additional questions there, ask again, Abigail. So in Spruce, you can create automations based on phone calls coming in, and you can choose, say, based on time of day, based on which phone number, and then you can set up length of time for it to ring. And then you can have it play a message with branches. So press 1 for front desk, press 2 for billing. And then each of those can then have automation, even auto text back based on time of day, branch of phone tree. I know back in the day, a lot of people would say like, press 5 for our address or fax number. That could be an auto text back, things like that, or a missed call during the day, have an auto text back that says, sorry, we missed your call. How can we help you? And these are just ways to engage automatically, not have a person say like, oh, we got a missed call, I should call them back. You don't need that. You have technology now. So those are some that you can automate. Also in the phone tree, we also offer a lightweight text tree, which I have coined but have not trademarked. But the text tree is like a phone tree, but with text. So you reply to text. We all do this with reservations for dinner and stuff. Reply 1 for new appointments, reply 2 for refills. And then you just type 1, 2 on your text, and then we can auto text up to 1 level of different responses and assign it to the right team. So again, the right person's getting the right message. So then the patient's getting care faster. And the other use case for that is urgent escalation. So if someone offer texting, it's awesome, but don't get text all night. Have an auto reply that says this is not going to be checked till next business day, or if you want to mark this as urgent, reply 1, and then just those. Like, just because we're offering all these tools doesn't mean we have to give away our entire personal life as well. So those are my things about the automation. And then Spruce obviously has the paging, which is a very lightweight task management. But if you're finding that you're using Spruce paging a lot and you'd like it to be more extensive to that patient, then that's really when you want to start considering Doc Health and looking at it. And that's what we're going to show you, how you can message and doc right to the patient in Spruce. So does that Did I summarize that question well?
I think so.
Okay.
I think that was great. And we're doing good on time, but I know we want to spend some time showing how that works together. So I'm going to keep us moving. Yeah. So task management, the good news is you're already doing this. I love that. I'm going to let you speak to this case study, Mike.
Yeah, just real quickly even on the last slide, like, everyone has their own form of task management. For me, it was like just remembering stuff in my head, and that invariably failed. And so that was why we sort of sought to build a better tool. But folks have their paper checklist, and I remember as a resident, and a fellow, having my sort of paper that I folded up in four and stuck in my back pocket, and invariably left it somewhere. So everyone has their process, but we want to give folks a shared space where they can collaborate on that. This is a great example of creating operational efficiency in an organization. So this is a mental health startup that is seeing 20 to 25 new patients every day, and a lovely nurse was managing that process. So each and every patient, they would take the form that was filled out on their website. They would review that form. They would then, if appropriate, send them a follow-up email. Then, if appropriate, they would go and create a record for that patient in the EHR. And it was taking them between 30 and 60 minutes for every single patient that they onboarded. So this was a full-time job for a well-qualified nurse. And it was preventing them from scaling, because this company wants to grow fast. And the single nurse was really at her maximum. She was spending her entire work week just onboarding patients. And what we did was just automate and integrate that process. So we took a form from their website, and we kicked off a workflow in Doc that was for new patient onboarding, and pulled in the information from that form. So a type form, or a jot form, or a Google form. We then kicked off the workflow in Doc, assigning the right tasks to the right team members, some of which are manual. So not everything can be automated yet. But one of the tasks is call the patient, verify their insurance, and talk to them about their diagnosis. That's a human task. That's not going to be automated, but send off a marketing email, create a record in your EHR. That's all data moving from one system to the next that we can automate. And so in doing that automation piece, we save them, that process went from 30 to 60 minutes down to like 3 or 4 minutes. And that's the sort of thing that we're doing for practices as well. Obviously, this is a technology company, so they're a bit more nimble and technology forward, but arguably many, particularly mental health practices, are very administratively thin organizations, and they need efficiencies, they need tools to manage this process. And so that's where we come in.
That's great. That's good. Keeping us going, I want to just have you both speak to how these solutions can be far better together.
Yeah, this is a super quick video, and perhaps not of the best quality, so apologies there. But yeah, basically what you see there very quickly, and it'll rewind in a second. So this is a patient profile on Doc. You can customize that profile, and so what that allows you to do is basically put whatever metadata you'd want in there, whether it's pulled from your EHR or it's pulled from another source of truth. And what you're seeing here is us click on the Spruce link. So we can, what we call a deep link. So you can create a hyperlink within a patient's profile. So we were in Joey Crohn's chart or profile within Doc. That can deep link into that patient's profile, or I forget what we call it, a demographic card in Spruce.
Contact card, yeah.
Contact card, thank you. So what we're doing basically is now seamlessly connecting the profile in Doc with the profile in or the contact card in Spruce to allow for that communication piece. And I hope I'm not over speaking here, but our hope over time is to work better together and more deeply integrate, so that we can trigger more actions and do more of the, I'm sure there's some questions referring to this, but our hope is to work more closely together so tasks can move seamlessly around, and communication, which is not our area of expertise. So Doc is really focused on the task management. And we think Spruce is amazing because they're so good at all the communication elements around, interfacing with the patient and managing the phone calls and the emails and all that. And so together, I think it's 1 + 1 = 3 sort of thing. But that's going to happen more and more over time.
Yeah, I just wanted to kind of speak more generally about Spruce and integrations. Spruce is integrated with Doc in that when you're in Doc's platform and you're in the patient, like that's the doc platform, there's going to be a link in there to open up the contact card in Spruce. So picture in your head, you're managing this patient. You're like, okay, let me message them. So you click it, boom, it opens a contact card. And then as you know, in the contact card, then you have the decision, do I want to text them? Do I want to call them? Do I want to secure message them? Do I want to video call them? So it just brings you right there to do that action of communication with the patient. So that's our first phase of this integration. And so if you already have Doc, you're going to see, you can get that connected. The next phase is demographic syncing, but also don't forget, Doc already does some syncing with likely your EHR. So you already have that, but the next phase would be doing more syncing with demographic info and potentially moving messages, into each other's platforms. So a lot more we can do, since we did just launch our public API not that long ago. So it's just still new. So look out for more to come there and more integrations. You'll be on our mailing list or on Docs. You're going to be getting those announcements. So just wanted to kind of call that out a little bit more, because I think someone else had a question about some integration. So if you have specific integration questions, ask them in the chat, and Jen behind the scenes is answering those. But someone asked specifically Simple Practice and some other, like we're not integrated with Simple Practice right now. You can import your patients, and you can also copy and paste anything from Spruce to any EHR. So what are your thoughts on some of your EHRs you guys are looking into getting integrated with?
Sorry, was that a question for me?
Yeah, so like
the audience.
Yeah, some people are asking like, how are you connecting to EHRs? So explain like the connection to EHRs.
Yeah. Happy to. And maybe just so people don't get nauseous or dizzy watching this over and over again, we can just.
Oh yeah, let's move to the next slide.
Let me go to the next slide.
Yeah.
Awesome. So just to address the Simple Practice one real quick. So as far as we know, they don't have open APIs, so we can't automate and deeply integrate with them. But as Jess mentioned, probably for how you guys work with them, if you can download an Excel or CSV file from your EHR or your clinical system, we can upload that into Doc, and then Doc can have those patient profiles or client profiles in Doc. Our preference, of course, is to do deeper integrations. And so, things like Elation, AdvancedMD, Athena, those types of EHRs where they have open APIs that we can connect to through our professional services, we can connect those. And part of what we do is not only the demographic sync, so that we know when a task is created, it's for this patient with this contact information, but how do we automate as much of that work being done in the clinical system to bridge to that administrative thing that I mentioned earlier on. So a new visit is booked in Elation. That can kick off the new patient process that has the administrative tasks associated with it in Doc, or a form is filled out that can trigger us writing back to the electronic health record and saying, this is a new patient who's coming into the practice, let's create a record for them. So what are the orders and events that are occurring in the EHR? And then how can that trigger the appropriate tasks or workflows in Doc? That's what we spent a lot of time working on.
A couple of questions came in that I just want to share to the whole group because they may have missed them in the Q&A. If you want to get integrated with Doc, you have to sign up for Doc first and then ask them to integrate with your Spruce. So Doc is a separate company. They have their own demoing, and if we're going to do the contact info next, so you can reach out to them. But then some other people had some questions about the SLAs. So are you able to show that a task is overdue? I think yes.
Yeah, so we have obviously an audit trail around tasks. We have escalation rules around tasks now, so that if those tasks aren't complete based on the SLAs have been established by an organization, they can be escalated. So they get kicked up to the medical director, and they start looking big and red and scary. And so we have the sort of rules to keep the that accountability as we've talked about so much today. So yeah, I mean, it is all about just setting up your processes, and if escalation rules and due dates and start dates and all that stuff are part of that, that's easily navigable from Doc. Maybe Carrie, could I ask you to just forward to the next slide, and folks can, if they're wondering how to contact Doc and they want a demo. So for us, we are happy to meet with folks. We offer a 30-minute demo, and frankly, we spend a good portion of that time understanding your organization. You know, what are your pain points? What are the tools that you're using? And hopefully Spruce is one of them. And how do we best, work with you to help, create that structure, accountability process. And then, we offer a free trial after that. And, certainly our consultative services down the road, if appropriate.
Yeah, I love that. And Jess, what's the best way for someone who is not already acquainted with Spruce to get more information?
Yeah, if you want to start a 14-day trial, you can go to sprucehealth.com and start your trial there. You can also email sales@Spruce Health to get a hold of me specifically, or the sales team, but I'll see them. But if you're a current customer and you want to set up any automations, or you already have Doc and you want to set up that integration, email support@sprucehealth.com. And then our help center, also help.sprucehealth.com, has a ton of stuff about our automations, our phone trees, all of that, but we're all here to help. And per usual, you can also message into Team Spruce. We're a communications platform, so we say do it whatever way, message, email, anything.
Yeah.
And also scan this QR code, and that will create a little email. So to contact Doc, it's pretty slick, actually. So just use your phone. You can scan the screen right now, or if you're watching the recording, and send them an email, and they'll get right in touch with you. Yeah.
I love it. I feel like we covered a lot of ground today, and we've answered a lot of questions. If anybody has any last minute burning question, throw it up. Otherwise, reach out. A big, big thank you to Mike for joining us today. That was incredible. Thank you so much. And Jess, as always, you bring so much great content to the table, and incredible information there. So thank you. And thank you to our audience for sticking with us for the duration of this. Reach out with anything more, and we're so glad that you came.